Hi, Kemp Bottles from Philadelphia. In the previous two videos, we talked about why we have to decrease per capita cost and increase quality of American healthcare. We spend too much money on healthcare and we don't get high quality healthcare in return. Today, I want to talk about Medicare. Medicare pays for more than half of all healthcare in the United States. And we've already passed, as you know, the Affordable Care Act. And the Congressional Budget Office estimates that over about a 10-year period, the Affordable Care Act will cut $400 billion out of Medicare. It's supposed to reduce the annual growth rate from 6.8% to 5.5%. Now the theory is that, well, there'll be more people with health care insurance. 32 million people are covered in the ACA. So that will produce additional revenues for hospitals and doctors. But the Medicare chief actuary actually predicts that provider cuts in the ACA will make 15% of Part A providers unprofitable by 2019. There's an AAFP survey from the family practice folks, and they thought if there's cuts in Medicare, it would lead to 13% of American family doctors closing up their offices and 70% refusing to take more Medicare patients. This on top of the fact, in January 2012, we all know there's a slated 29.4% cut in Medicare physician payments. So, wow, it sounds like there's going to be less money coming from Medicare, which means less money for all doctors and hospitals. It gets worse. In 2010, the debt of America was 62% of the GDP. By 2021, the debt's supposed to reach 77% of GDP. And that's why there was all this rancor between Congress and President Obama about raising the debt ceiling. Well, they passed it. They passed the Budget Control Act of 2011, and we better think about what does that mean for healthcare. It means a lot. And I got to tell you, it's not good. So, what was passed in the law, this is law, this is not talking, this is law. What was passed in the law that they have to reduce the budget deficit by $917 billion between 2012 and 2021. Now, Medicare and Medicaid are not affected by that first almost $1 trillion cut. But then they created a bipartisan super committee of Congress that has to come up with $1.5 trillion in cuts over 10 years, in addition to the first $1 trillion. But by doing that, they allowed Obama to raise the debt ceiling by equal amount, which will take us through the elections. So we're not going to default on the federal debt. Good idea. Okay, so this Budget Control Act of 2011, which is already federal law, says if the bipartisan committee cannot agree on an additional $1.5 trillion in cuts, then it triggers an automatic across-the-board $1.2 trillion in cuts that includes Medicare and defense. Social Security and Medicaid are protected from the automatic cuts. Now, if they can't agree to cut the $1.5 trillion and you go to the automatic cuts, the cuts are limited to 2%. But they also say benefits to Medicare beneficiaries cannot be altered at all. What does that mean? Less money for doctors and hospitals. And as I calculated it out, if the automatic cuts go into place, it's $10 billion to $15 billion less for American doctors. Wow. So the Budget Control Act of 2011 is law. What's the timetable? It's happening already. By this Thanksgiving, they have to come up, the committee, with a plan to cut the $1.5 trillion. They may not even be able to come up with that compromise. Once they come up with the $1.5 trillion plan, it goes to the House and Senate. It's voted up or down. It's just a majority vote. There's no filibustering in the Senate, and they can't amend it. It then goes to President Obama, and it has to be signed into law by Christmas of this year. If they don't sign it into law by Christmas of this year, the automatic cuts go into place. So, you can see that we've got a big problem in terms of Medicare is going to provide less money for hospitals and doctors. That's the end of this exciting chapter in our federal budget deficit and healthcare reform. Next video, we're going to talk about, well, if the automatic cuts go into place, what's going to get cut? Stay tuned. Kemp Bottles, www.kempbottlesmd.com from Philadelphia. Thank you.